Hi everyone. Recently I posted on Instagram that I had Fraxel laser resurfacing and I got a whole bunch of questions, so I thought I would answer them in today's video. So starting off, let's talk about lasers a little bit and then we'll get into what the experience is like and what the benefits are and what you can expect from the treatments. So the two lasers I'm going to talk about are the Clear and Brilliant, which comes in two forms. There's the Clear and Brilliant and the Clear and Brilliant Permea. And then there's the Fraxel Duo, which I will talk about, which is the laser that I had done. The Clear and Brilliant can be thought of as a baby Fraxel. It's a much more gentle laser treatment than the actual Fraxel laser itself. It comes with two wavelengths. One is used to target the texture of the skin, and that is at 1440 nanometers. And the second one is more to target brown spots, hyperpigmentation, and sun damage, and that is at 1927 nanometers. And what this laser does is it pokes tiny little columns of light into the skin, and that light it's not quite damage, but that overheating stimulates a healing response from the surrounding adjacent healthy skin. And this laser is quite gentle, so after the treatment you may be a little bit pink or red for maybe half an hour to an hour, and that's generally it for downtime. There really isn't any downtime with this laser, and then you may feel a day or two later a sort of a sandpaper feeling to the skin, and after that you get this beautiful glow. And sometimes people will notice that you have a glow before you do. I know that some stranger on the street commented that my skin was glowing one time after I had this, and I was so surprised because I wasn't staring and analyzing my skin, but I was really happy to know that the laser did its job and that my skin was reflecting light nicely. The Permea, the process is the same, except, like I said, the different wavelength targets the dark pigmentation in the skin and helps remove it. Now, I did say that the Clear and Brilliant is like a baby Fraxel, so about 3 to 5 Clear and Brilliant treatments equal 1 Fraxel treatment. So Clear and Brilliant is great to do if you really don't need that much done. You're more into prevention. Let's say you're in your 20s, or if you have a very busy schedule, you don't have the time for a downtime, and you want to sort of upkeep your skincare without having any kind of downtime. Moving on to the Fraxel laser, it's a generic term. Fraxel just means fractionated laser, and there are all kinds of lasers out there. Specifically, the one that I had is called Fraxel Duo. And this laser works by emitting two different wavelengths into the skin. One is 1550 nanometer wavelength, and the other one is a 1927. This laser is more intense, and it works the same way as the Clear and Brilliant. It's just, it's the full guns. And basically the fractionated, and it's true for Clear and Brilliant and Fraxel, what it means that the laser is a fractionated laser, it means that only a fraction of the skin is actually penetrated by these tiny microscopic columns of light. And the skin surrounding the skin that's penetrated with the columns of light is not lasered. And so the injury, the heat injury that's provided by the column of light is more quickly healed by all the untouched healthy skin around it. And so effectively what the laser does is it induces the healing response in the skin without really damaging it. And what the healing response does is it improves cell turnover and boosts the collagen that we want to boost in our skin, because as we age we lose collagen starting in our late to mid 20s. The way the Clear and Brilliant and the Fraxel procedures are done is first by applying numbing cream for about an hour to 45 minutes before the treatment to reduce any discomfort. The difference between the two treatments is the Fraxel, despite the numbing cream, is a little bit more uncomfortable than the Clear and Brilliant. The Clear and Brilliant, you basically don't feel anything at all, With the Fraxel, you may feel some heat and you may feel some snapping bands, but I wouldn't say it's painful. At best, I would say it might be a little uncomfortable, but on a pain scale of 1 to 10, I wouldn't go past a 3. Now, we are all different, and some people are more sensitive than others, but the fact that the numbing cream is applied helps reduce the discomfort a lot. And you should never have this type of laser done without numbing cream. Every provider should numb you up very well before starting this procedure. Okay, now let's talk about the benefits of this procedure. Basically, as I mentioned before, you increase cell turnover, you boost collagen production. If you might wonder, well, how long does this last? It's forever, but that can be misleading. It depends on how you look at it. If you imagine that your collagen levels are here, but you're aging, so they're continually going to go down and down and down. Well, so they're here, and you go for Fraxel laser, and it boosts your collagen to here. So it's still going to go down and down and down as you age, but now you're starting at a higher point. So that is the permanent change, even though the collagen continues to drop as we age. This procedure can be done on the face. It can be done on the chest, on the hands. If you have sun damage anywhere and it bothers you, you want to reduce the sunspots. It can be done just underneath the eye area to help with the fine lines and wrinkles. It's a nice maintenance for prevention. Prevention is always easier than treatment. So basically what you get from this procedure is improved collagen production, which will diminish fine lines and wrinkles. It will diminish the appearance of scarring if you have post-acne scarring, because it resurfaces that top layer of the skin. It will reduce pore size by the sheer fact that you have more collagen in the skin, so the collagen will tighten around the pore and shrink it, and it will also tighten it around the opening of the pore and also shrink it. So it literally does effectively shrink pores. And of course, by the resurfacing, it gives you a nice glow because you just have fresh new skin showing and all the dead skin is sloughed off. The downtime you can expect after a Fraxel Duo is more than the Clear and Brilliant, as I mentioned, and what it looks like is a sunburn. You basically have a red face, just exactly as you would after a sunburn, and that can last, everyone's different, but I would say anywhere from 2 to 4 days. And after that, you don't ever peel the way you can after strong acid peels or after ablative lasers. Basically, your skin begins to feel like sandpaper, and that sandpaper feeling is tiny little micro scabs everywhere that little column of light penetrated. So it's only those tiny, tiny little scabs that start coming off. And as I mentioned before, because less than 50% of your skin actually gets these columns of light, you're not going to peel like sheets of skin coming off. You're just going to have these tiny punctate little dots where the beam of light went in, and they're going to start sloughing off, and it feels a little bit like sandpaper. And that lasts just several days, and it just sloughs off as you wash your face and dry your face. You want to be really gentle with your face after you've had the treatment, with very gentle wash, preferably non-drying, fragrance-free, very gentle wash, and then apply a very basic moisturizer, and anything that would produce or stimulate or boost the production of elastin and of collagen. I used Skin Nectar by Elastin. It's a product that has pretty high-tech, sophisticated technology. It helps remove the sort of the broken and non-useful collagen and elastin, helps clean that out, and then it helps boost and stimulate the production of new elastin and new collagen. So that, together with the laser treatment, really boosts the collagen production. And in addition to that, it's a very soothing treatment. It's cruelty-free, fragrance-free, and it's quite thick, and so it's also got that barrier protective feeling to the skin. And that's literally all I used for days in the morning and in the evening. And just for the first 2 days, I would intermittently put more on as my face felt dry and hot. I would just put it on to soothe it, and I really just wanted to get as much of that collagen stimulating going as I possibly could. So that was my post-care treatment. This is a treatment you can do yearly. That is a great way to upkeep your collagen production. Or you can choose to do the Clear and Brilliant maybe 2 to 4 times a year. But the way you can think about it is whatever you do, it boosts your collagen from wherever it is up a little bit. So whether you do it once every 10 years, once in a lifetime, or once a year, you're always going to bump up that much more from your starting point. So it doesn't really matter if you only do it once or if you do it twice or 4 times. Every time you do it, you basically help your skin regenerate, resurface, and it's all about that collagen and that skin resurfacing. So I hope this gives you a better understanding of Clear and Brilliant treatments, Fraxel treatments, why do them, what to expect from them, what kind of downtime you can expect, how often to do them, and if it's worth it or not for you. If you enjoyed this video, give it a thumbs up. If you have any questions, please feel free to leave them down below, and I will see you next time.